today's webinar, Improving Blood Pressure Control with the AMA MAP Hypertension Program and I2I tracks. My name is Zach Clint. I'm the Vice President of Client Success at I2I Population Health, and I want to thank you all for joining us today. If you're looking at the first slide within the content here, I want to just note really quickly, this says Session 1, AMA MAP Hypertension Overview. This is a series, and we'll be back next Thursday and then the following Thursday on 8/1, and then I believe 8/8 at 1 o'clock Central to follow up and dive a little deeper into this content as we go. But today is an overview, so I want to introduce our presenters today. Crystal Amato is a Senior Manager of Clinical Operations at the American Medical Association, has been an integral part of our collaboration with the AMA really since we got started in this project. Josh Glick is the Senior Director of Quality Management at I2I Population Health. Josh is a tracks expert, and we'll be able to talk from a very experienced place about the work that we've done to embed the hypertension program into the I2I tracks application. So the agenda for today, pretty straightforward. We want to take a minute to do a summary sort of overview of the AMA MAP Hypertension Program, and then talk about the collaboration that we've been doing for some time now. And again, not just sort of reading these bullet points, but also dive into some of the ways that we've embedded the metrics and the tools from the AMA MAP Hypertension Program into the tracks application that can help you as providers manage your hypertension population. So that matches up pretty well with the learning objectives for today to describe how the AMA MAP hypertension metrics can be used to guide improvement in blood pressure control, as well as demonstrate I2I tracks functionality that can assist in managing your hypertensive population. So with that as an overview, let me advance slide one more time and turn this over to Crystal to get into the content.
Thanks, Zach. And thank you all for joining us here today to kick off the AMA MAP Hypertension Learning Series. Today's session will be an overview of the program, and it'll prepare you well for the learnings to come in the upcoming 2 sessions. And it'll provide some really good, valuable resources as you work towards hypertension control in your patient population. Next slide. At the AMA, our mission is to promote the art and science of medicine and the betterment of public health. And one of the ways we fulfill that mission is through our focus on cardiovascular disease prevention. As you might be aware, we're closing in on nearly 1 million deaths per year in the US due to CVD. And this is just based on the latest numbers from the CDC and AHA. And that's a really big number that I want to put into a different context for us by taking us to Chicago, where we're based here in the AMA. And the Chicago Cubs baseball stadium is here, and that's Wrigley Field. So now let's imagine that field filled up 22 times to capacity. That's how many lives are lost annually to CVD in our country. Next slide. Now, if we take a look at how we can prevent CVD events, like heart attacks and strokes, one of the measures that can make a difference is blood pressure control, and that stands out as a key opportunity. And that's where our program focuses in. Next slide. All right, so as we look at hypertension, we know there are some key processes or problems that we continue to run up against. Oftentimes in our care settings, we have inaccurate blood pressure measurement. We know that measurement processes can vary from practice to practice and even clinician to clinician. And that variation can lead to errors in blood pressure measurement and ultimately inaccuracies. And that can really impact how we diagnose and assess the effectiveness of treatment. And the single biggest problem we have with achieving blood pressure control is the issue of treatment inertia or therapeutic inertia. This can mean that we have a patient with an indication to initiate or intensify their blood pressure treatment, but we fail to do so. And we know that many of our patients with uncontrolled hypertension are often suboptimally treated. And that last area of problems that we run into are related to patient engagement. We may encounter non-adherence to treatment plans for a variety of reasons. Oftentimes, we don't have frequent enough follow-up with our patients when their blood pressure is uncontrolled. Likely in your organization, you've experienced similar problems in managing hypertension. And I would love to hear from all of you to learn what you perceive as your organization's top challenge to improving blood pressure care. So Zach, thank you so much for launching that poll. So if you want to take a moment and go ahead and give your input here. And then Zach, I can't see the results on my end, so as it's looking like we are getting good respondents, I will just have you stop that poll and display for everybody.
Looks like we got a few more that are rolling in. I'll give it just one more second and then we'll give you about another 10 seconds to let you weigh in here, and then I will display the results. Okay. All right, Crystal, let me know if you can see those results.
Yes, we can see it. All right. So this is not dissimilar to what we hear from organizations that we work with. So, quite a distribution here that we're seeing. We're going to dive into all of these problems and really give you a little bit more insights to help guide your care of these patients. All right. And if we go on to the next slide. So as we look at those problems, we would propose a framework that we can use to address them. And this is the AMA MAP framework. It refers to the 3 elements for chronic disease prevention and management, and that's measure, act, and partner. In the context of blood pressure, MAP refers to measure accurately, to obtain actionable blood pressure measurements, to diagnose hypertension and assess blood pressure control. Act rapidly to initiate and intensify treatment when indicated. And partner with patients to support patient activation and assess to improve that adherence to treatment. And all of these pieces work together in the framework to improve blood pressure control. Next slide. The way that we've brought the MAP framework to life is through the AMA MAP Hypertension Program. We offer this program free of charge and work with organizations nationwide to implement this program to improve their blood pressure control. Each MAP hypertension component incorporates evidence-based strategy and action steps, supporting tools and resources that enable you to make these system changes, QI and clinical implementation led by AMA improvement specialists. So that's that one-to-one coaching to organizations and implementation support. And of course, performance metrics, reports, and dashboards. And these metrics have been integrated within I2I tracks and are accessible to you today. Next slide. These metrics consist of the AMA MAP hypertension process metrics, which, as mentioned, track to each component of the program. And then additionally, there are outcome metrics that you're already well accustomed to. And we'll take some time later on to get into the specifics of these metrics and how they relate to the program. Next slide. And what we know after years of implementing and studying our program nationwide is that it works. This example here is in a practice with over 16,000 patients that we implemented with, 16,000 patients with hypertension specifically in South Carolina. And this practice had a baseline control rate of 64%. And after 6 months of working with us to implement the program, they saw a 10% improvement in control rate. And after the AMA support ended around 6 months, the really great news is that they sustained their gains even through that 12-month mark. So before we move forward and think, or talk about in depth what those metrics are, I wanted to pause here for any questions that we might have in the Q&A. Are we seeing anything?
No questions so far.
Okay, wonderful. Thank you so much. All right, we can go to the next slide. So we're very excited to collaborate with I2I and bring the AMA MAP hypertension metrics to all tracks clients. And we'll tell you more about what AMA have done to collaborate and how it can benefit your organization. Next slide. As mentioned, the AMA has collaborated with I2I to make our metrics, tools, and resources all accessible to you through I2I. We want to provide high-level overview of what you can expect as an I2I client if you are seeking that direct programmatic support with I2I or with AMA. So essentially, what we bring in terms of the AMA is expertise in hypertension control, clinical operations, and quality improvement. For organizations implementing our program, we have a skilled and experienced practice facilitation team who can offer tailored guidance to collaborating organizations informed by their baseline data and their current condition assessment. And I2I brings their expertise in population health and data solutions to support organizations. Our aim is to provide collaborative support in operationalizing the program and guidance on how to customize care processes and workflows, all while leveraging the technology that's already accessible to you. We work with collaborators to activate the program and enable measurable success. And this support spans the duration of our engagement, from planning to launch through sustainment. Next slide. Before we talk more in depth about the measures and functionality, wanting to see how familiar everybody might be with the metrics that are available today. And we do have a poll, if you could please launch that. So wanting to see how aware you are, or what your current use might be of the AMA MAP hypertension metrics in your organization, whether you weren't aware of them at all, you're aware but maybe not using, you've reviewed the metrics but you're not actively working on hypertension at this time, or if you're actively using for the management of your hypertensive population. So just take a moment to complete that.
Still collecting those responses, and we'll give it a few more seconds here. All right, last few seconds to let anybody weigh in. Okay, Crystal should be able to see the results now.
Okay, so a pretty even spread here. So I think this will be a really great opportunity for us to dive a little bit deeper into what is available to you today. And if you are using it, what might be some ways that you can deepen that use of the metrics? So wanting to start with this high-level overview of what already might look familiar to you today in tracks. If you're on version 7.6.28 or newer, you'll have access to the AMA MAP Hypertension Metric Bundle. And that's inclusive of those drill down capabilities that you're very accustomed to within tracks. So these measures include 2 outcome measures as well as the 4 AMA MAP hypertension process measures. For healthcare organizations that have opted into our program, I2I provides support for validation and automated data transfer and distribution via Report Scheduler. And I want to also call out that there's new visualizations that you'll all be able to access for the AMA MAP hypertension metrics. So Josh is going to talk on those in greater detail later on. And next slide. All right, before we do a deep dive into functionality, let's spend some time to get familiar with the AMA MAP hypertension metrics. So what I'm going to provide is truly an overview of what you can expect to find within our metric user guide. And we'll provide some details on where you can find this document later in the presentation. Just for now, let's explore how we might use these metrics to make actionable changes within your organization that can really drive improvements in hypertension control. Next slide. Starting first with the outcome metrics. This measure likely is familiar to all of you as CMS 165 or blood pressure control. And this metric tracks the percentage of patients 18 to 85 with an active diagnosis of hypertension before and continuing into the measurement period, or diagnosed in that first 6 months of the measurement period. And for the numerator, they have controlled blood pressure, meaning less than 140/90. So the AMA does have suggested goals for most of our metrics. And then in tracks, these goals are defaulted as your targets. So for this metric in particular, we recommend a goal of at least 70%. And I just want to note for that organizations that implement our program, we would host a baseline data review and discuss goal setting with you and determine what your desired goal might be, as it could be different than our suggested goals here. Next slide. All right, there is a second outcome measure, and that's blood pressure improvement, which is aligned with CMS 65, which you're probably already familiar with as well. And this is where you can get credit for improving blood pressure. It's looking at that same denominator population as the blood pressure control measure. And for this measure, we're tracking that improvement in systolic blood pressure of patients that had a previous visit with uncontrolled blood pressure. So the numerator is looking for that 10 millimeter of mercury improvement, and it's giving credit truly to those who make that improvement but don't quite reach control. For this measure, the AMA does not have a specific goal. Next slide. Now let's talk about the individual AMA MAP hypertension process metrics that will help guide your efforts toward blood pressure control and improvement. The first is being the AMA MAP hypertension confirmatory repeated blood pressure, and this corresponds to measure accurately. This measure is looking at the visits for patients who are ages 18 to 85 with hypertension, with at least one uncontrolled blood pressure documented during that visit. And during these visits, we're wanting to ensure that patients receive a confirmatory blood pressure, and that is documented. So we recommend setting a goal of at least 50% for this measure. Some action steps to consider for this measure are to develop workflows and processes that include repeat blood pressure measurements when indicated and ensure proper documentation of results. Today, I'm just providing a very high-level overview of measure accurately. Our practice facilitation team is very experienced in coaching organizations on clinical workflows and processes and have implemented the program in dozens of healthcare organizations nationwide. So in the upcoming webinars, you'll learn a lot more about this. Next slide. All right. The next measure is the medication intensification measure, and that corresponds to act rapidly. And this measure is aimed at tackling that therapeutic inertia that we talked about earlier. By definition, we're looking for the visits for adult patients with hypertension whose blood pressure is uncontrolled, meaning greater than 140/90. And to achieve the numerator for this measure, we're looking to see if this patient has had their treatment initiated or intensified. And that's defined as the addition of a new class of blood pressure medication. Typically, intensification occurs in 1 to 7 visits, 1 out of 7 visits, so about 14% of visits. And the AMA recommends a goal of at least 30% for this measure. And the best way to meet this measure is to implement a treatment protocol, really to improve the frequency of that intensification. AMA physicians and our clinical pharmacists on our team can provide specific guidance and more detail around this. Once again, something that you'll learn more about in the upcoming webinars. Next slide. All right, as we move on to partner with patients, there's 2 measures we're going to explore. The first being SBP reduction after medication intensification. And this measure serves as a proxy for medication adherence. This measure builds on what we just described in the medication intensification measure. For patients with uncontrolled hypertension that did have their medication intensified, so those patients that fell into the numerator, it's tracking to see what their average change in systolic blood pressure is after that medication intensification. So this helps to show medication adherence of a patient and the effectiveness of their treatment prescribed. Because of the way that this measure is calculated, there is no suggested goal. And as we look at action steps to promote adherence for medication, we want to make sure we're educating our patients on their medication, its purpose, how and when to take it, and then the use of collaborative communication to help support the patient and ultimately their adherence to treatment. And once again, our facilitation team is very experienced coaching to this and will provide deeper insights. Next slide. The second measure that aligns with Partner with Patients is follow-up visit within 4 weeks. The intent of this measure is to make sure we're getting patients with uncontrolled hypertension back in office for follow-up. We're looking specifically at visits for patients with ages 18 to 85 with uncontrolled hypertension. To satisfy the numerator, we want to ensure that patient comes back for a visit within 4 weeks. And the AMA recommends a goal of at least 50% for this measure. Some steps that your care team can take include scheduling of a follow-up appointment and the use of lists to identify patients that need outreach and we need to get them back in the office. And our practice facilitation team, of course, will be speaking to this in the upcoming webinars as well and can provide some deeper insights. Just want to pause to see what questions we might have in the Q&A. I'm not seeing any open. Let me check the chat, see if we've got anything there.
And no questions right now.
Perfect. All right. So now that we have a solid foundation for the metrics that exist in tracks, I'm going to hand it over to Josh to talk about some of the functionality that you can leverage in tracks to get the most out of these metrics. Josh?
Awesome. Thanks so much, Crystal. Thanks for the introduction and for kicking us off. And I want to reiterate that I2I is incredibly excited to be collaborating with the AMA on this program. We feel strongly that the I2I Tracks application is such a powerful tool to help to lead such a program and engage with patients and manage and measure their levels and act on those levels and to be able to partner with the patients. And so we're just so grateful to be working with them and you know, it's been such a wonderful collaboration. Go ahead, Zach. So for some of the items that I just mentioned, I2I Tracks combines some of the most comprehensive patient views with actionable insights into user-centered workflows for care coordination. And our tools integrate so well with the goals of the AMA MAP Hypertension Program. And we've been having more and more organizations enrolling every day and using the Tracks tools to coordinate with the patients, to manage the different measures, running the reports, evaluating the patients that are in the numerators or denominators, creating new workflows and working with the AMA in order to act and to partner with the patients. And yeah, so we're actually going to dive into how you can run your report. And we're just going to touch the surface in this first presentation. We're going to dive even deeper in the next two presentations on how you can utilize Tracks. But this is just going to be a little bit of an intro to that. So go ahead, Zach, we can jump right in. If you're not familiar with the report, it is actually located in the report section. I apologize that screenshot came out a little bit grainy there, but in the very top header of your Tracks application, you can navigate to the report section, and there's a drop down that says AMA. Once you click on AMA, you will be given two different options. You can either run the metrics bundle, which is the report version, or you can also run the metrics bundle dashboard. Now, you might be looking at your own Tracks instance today and say, well, I don't have the dashboard. That is going to be available early next week. So our developers have been working hard on making sure that you all have visualizations in your hands as well. And so 7.6.30 will be available early next week, and that will enable you to have access to the dashboard portion of this as well. All right. So we've also added some other functionality. So this screen might look a little bit familiar, but it might look a little bit bigger than before. On the version that's being released on Monday, you can also begin to stratify your reports, your dashboards by race and ethnicity. So that was, again, a collaborative effort with the AMA, where we really wanted to be able to look at different populations and be able to stratify those populations when viewing the AMA report. And so we made that available. But similar to any report that you've run before, you're able to set your date ranges. All right, you see that in the upper left-hand corner. And just a quick note, if you're running the dashboard, you're only going to have to set your anchor date there at the end, because it's always going to run that 12-month period running back in time. If you're running the report, you'll obviously have to set either a month's date range or a year's date range to look at the data for this particular report. And then, of course, I already mentioned the race and ethnicity additions, but you can also stratify your information by location, providers, financial class, migrant or homeless status, and tracking types. What we've been doing with the AMA is actually stratifying by rendering locations. So that way we have the ability to look at which locations that are enrolled in the program, how well they're doing with the program, and the improvements that they've been making in comparison to some of the control sites that are not implementing this program. And then we can start to compare and contrast and start to look at how we can begin rolling that out to the other locations. All right. And once you've clicked the OK button, you've set all your parameters, you'll be able to run your report. So again, very similar to any sort of report that you've run before, whether it be your UDS report or your IPHA reports, you will get your numerators and denominators. And we have inserted the target goals that the AMA has set up for us. All right, so in that target column, you'll always be able to see those percentiles and whether you're meeting those or not. All right, and this is the dashboards. So again, you don't have access to these today, but very early next week, you're going to have access to these dashboards. And we have all 6 of the measures built into here. And you'll notice that there's a light blue highlighting. So those are the goal ranges. When we build dashboards, we don't have actual lines, and this actually correlates perfectly with the goals that the AMA have set, because a lot of the goals are greater than or equal to 70%, or greater than or equal to 50%. And so what we've done is we've highlighted that greater than or equal to range, and hopefully, your organization can be in that range or strive to be in that range. And so this will give you a nice visualization of how you've been improving over time and making those changes. Data distribution. So again, kind of similar to the screenshot that we saw before, but this is now breaking it down by location. Again, setting up your filters, whether it be by race, ethnicity, location, provider, comparing and contrasting for your organization, and running the report where it makes the most sense. Maybe you create a provider scorecard as well, right? So the AMA program usually, again, looks by location, but maybe you create an alternate view for yourselves that you start to look at providers, and you start to share that with the providers that are engaged in the program and say, hey, look how we've done over time, and look who's leading the pack. So it's a great way that you can compare and contrast different populations and different teams within your organization. So in the future presentations, we are going to jump into some of the other I2I tracks functionality. We have ways that you can identify your populations and put stuff on your morning huddle, right? You can throw alerts on there and say, show me patients that are at risk for hypertension. If you notice on the example that we gave there in the screenshot on the bottom left, we have a protocol set that says risk for hypertension. And so this is evaluating patients who have 3 or more blood pressures that have been elevated, but they don't have a hypertension diagnosis. So maybe it's a cue for the provider to add that hypertension diagnosis to their problems list. We've got some other examples that you'll learn about in the forthcoming presentations. We can also start to put things onto the patient visit summary and maybe hand it to the patient. We can graph out their individual blood pressures over time. You'll notice that graph over that's in the center of that screenshot. And, the patient can actually start to see how they've been making improvements based on the feedback that they've been receiving and partnering with the patient and the provider. And so again, we'll give some more examples of how you can use other areas of TRACS, creating reminders, creating follow-ups, all these different things in the TRACS application. We're really excited to teach you all about it.
Great. Thank you so much, Josh. Now that the audience has a solid foundation for what AMA MAP Hypertension Program is, as well as the metrics and some of that TRACS functionality that will support its use, you might be asking, what's next? And where can I start to find out, where's the beginning point? How can I dive in deeper? So that's what we're going to get into next. Depending on your desired level of support, there's a path for independent learning and resources or deeper one-on-one programmatic support. And Josh and I will talk about these a little bit more in depth. The first being the I2I University. We wanted to ensure you had a centralized hub for all of your learnings and resources related to AMA MAP hypertension. Within I2I University, you can find several of these resources, including our metric user guide, validation guide, and we'll talk about this a little bit later. And additionally, you're going to find the webinar recordings from this learning series. So if you weren't able to attend all three, or if you want to share these learnings within your team, that content will be readily accessible for you. Next slide. Within I2I University, you're going to find that metric user guide, and we've talked about this a couple times today. So the overview, this is really truly an overview of the metrics, goals, and action steps that I provided earlier. It's all together in this document for you. And additionally, it combines information from our QI program along with I2I TRACS functionality to support your use of the metrics. And they're detailed metric specifications to support your interpretation and validation of the metrics. And there are links to AMA MAP hypertension tools and resources that you can leverage to drive improvement within your organization. Next slide.
We also have a validation guide available that I2I has put together. Big shout out to Patty Bisson, who was instrumental in building this tool. And it's a handbook that is really intended to help you all to validate, look at your patients and make sure that patients that are in the numerators and denominators should be in there. It'll walk you through how to run the report. It'll walk you through how to dig into the patients that meet or do not meet the different numerator criteria, and really give you a resource for managing the patients, looking deeper into the patients, and then starting to outreach to those patients as you engage in the MAP program.
Right. Today was the official kickoff of the independent learning series of the AMA MAP Hypertension Program in collaboration with I2I. And as mentioned, today's session is being recorded and will be posted to I2I University. And this content today was intended to be that high-level overview. In the next two sessions, we're excited to bring you more focused and detailed content related to the MAP program. The next session on August 1st will focus on measure accurately and partner with patients. You'll gain insights on how to leverage your care team to support these aspects of the program and drive improvements. The third session on August 8th will be solely focused on act rapidly and diving into treatment inertia. For this session, we would highly encourage any physicians, providers, or pharmacists on your team to attend, as the focus will be solely on their unique workflows. And all the sessions will be recorded and posted to I2I University as well. And we're going to be dropping some of those registration links in the chat for you as well to sign up, as well as these QRs. So feel free to send that information along to your team as well. Next slide. And we know that many organizations may want more direct one-to-one support from the AMA. And as a recap, the AMA MAP Hypertension Program not only includes the metrics available to you through TRACS, but it's an evidence-based, strategies and action steps are really aligned to that MAP framework. and the supporting tools and resources that make it easy to implement these changes. And of course, the program includes our quality improvement coaching and support from our practice facilitation team. So if you are interested in learning more, please visit our website and go to that Get Started section. You'll also find a link to the homepage in our chat, so keep an eye out for that as well. And with that, we can go to the next slide, and I think wrap it up for some Q&A.
Absolutely. Thank you both, Josh and Crystal. Sinead, let me throw it to you and ask if there are any questions that are in the Q&A section right now.
Not seeing any right now, Zach.
Okay. Then, given the time that we've got, let me open up the floor, see if anybody has any other questions or content or comments that they want to make. Okay. Well, thank you all for joining us today. I think you saw, and we alluded to the upcoming sessions. If you look in the chat, there's actually the links to register for session 2 and session 3 are actually in the chat right now to make that convenient for you. We'll continue to dive in a little bit deeper into both the metrics as well as the tracks tools in upcoming webinars, as you heard previously. And appreciate your time today and look forward to speaking with you in a week. Everybody take care.